So today we are talking about stress and anxiety disorders. So the presentation's focus is going to be looking at what is stress and anxiety disorders, the different types, causes, signs and symptoms, treatment, and risk factors. Then we're going to go into a case study and then go over what exercise prescription would be. So what is stress and anxiety disorders? So stress is a reaction to a stimulus that disturbs the physical or mental equilibrium as a response to a demand or threat. And it can trigger the sympathetic nervous system and fight or flight response. And then anxiety disorders are a nervous disorder characterized by excessive unease and apprehension that interferes with daily life. And that's the biggest part, is knowing that it interferes with daily life and causes to suffer a lot more distress than just the normal anxieties that most of us face. And it's accompanied by compulsive behaviors and panic attacks, and it's a reaction to stress. So, the different types. So with stress, there's routine stress, which is like daily stressors like jobs, school, and then finances, relationships, which are routine stress. Then we have the stress from a sudden negative change. And so that could be, say, you got divorced, got broken up with, maybe lost your job. That's just going to be some negative stress. Then we have traumatic stress. That's going to come from if you're in a really bad car accident, or if you're confused, raped, anything super traumatic would really trigger that traumatic stress. Then with anxiety disorders. To start, we have generalized anxiety disorders, which is just chronic worry. And then we have panic disorder, which is characterized by the sudden feeling of terror characterized by panic attacks. Then we have social anxiety disorder, which is intense fear driven by social humiliation and irrational worry of saying something stupid or looking stupid, just intense fear of being judged by others. And there's phobias, which is intense irrational fear of certain objects, things, places, and just trigger. And fun fact, so approximately 40 million Americans are diagnosed with anxiety disorders. So it causes the stressors, external, internal causes. External, it's like what we talked about before, job, relationship issues, finances, and really lack of free time, which is, I know, what a lot of us struggle with. Then internal cause, like chronic worry, pessimistic attitude, negative outlook on life, unrealistic expectation, like trying to be a perfectionist, then the low self-esteem, and then the all or nothing attitude. So it's saying, like, if I fail this presentation, I'm going to be a failure, I'm going to have to drop out of school. So then with anxiety, there's a couple of different factors. So with the biological and genetic factors, there's family history. So if you have an aunt or uncle or even your parents that got diagnosed with it, then you're more likely to get diagnosed with anxiety disorders. And sex also plays a role in whether you're diagnosed, as we see in a demographic picture. We see that women are 60% more likely to develop anxiety disorders than men are. Then a study done by the University of Maryland, they found that the amygdala, which is the fear center in the brain, is highly sensitive in individuals with anxiety disorders. And then we also see an imbalance of neurotransmitters such as dopamine, serotonin, and epinephrine. Environmental factors that contribute to anxiety disorders are traumatic life events, like we said, death, divorce, abuse, even family dynamics. So that's like saying the way you were raised, like whether you had like a learned fear or phobia of a certain thing, place, anything really. So we got signs and symptoms. So physical symptoms are very physical and cognitive symptoms, very similar with stress and anxiety. So with stress, aches, pains, nausea, chest pains, sex drive, diarrhea, constipation, some of the physical ones. And then cognitive and emotional ones are racing thoughts, inability to concentrate, the moodiness and feeling overwhelmed, and then anxiety. We got physical symptoms like chest pain, you got shortness of breath, you got those raising heart symptoms and tachycardia, you got your heart palpitations, so you're like really noticing that your heart's really pounding, and then you got upset stomach, and then you got apprehensive, feeling tense, irritable, restlessness, and like some intense fears. And so now everyone should have a little red flag triggering with physical symptoms because they're very similar to the ones that we see cardiovascular, pulmonary, and metabolic disease. So because these symptoms are similar to medical conditions like heart disease, hypothyroidism, they need to get checked out. And then even some medications, other physical conditions like low blood sugar and diabetes can even worsen the anxiety disorders. And so you need to meet with a physician and a mental health professional to determine the symptoms of your anxiety disorder. And they use the Diagnostic Statistical Manual of Mental Health Disorders to determine the type of anxiety that you're reporting as. And then the treatment of anxiety disorders, we see medications are usually prescribed to help with everyday stressors. So you see the use of antidepressants and anti-anxiety medications. So with that, we see beta blockers like propanol and etal are the most common ones used for anti-anxiety. And then the cognitive behavior therapy, psychotherapy, and exposure therapy are different types of therapies used to cure, not cure, but help with anxiety disorders. And of course, we know exercise is medicine, so exercise is a great way to decrease the symptoms with anxiety disorders. And then the effects of the medication, beta blockers, we know will reduce the heart rate response and it will reduce the maximal exercise capacity. And then the treatment of stress, exercise, and sweat. So they recommended 30 minutes a day, about 5 days a week, to really get down those stressing feelings. And they say to do rhythmic activities like walking, running, biking, dancing, etc. And yoga and tai chi are really good ways to help calm the brain and just develop a good relaxation. And then they also said treatment of stress would be stress management techniques, making time to relax, and then maintaining a healthy diet and getting a good night's rest. Some health risks associated with stress and anxiety disorders are high blood pressure, heart disease, skin conditions, loss of appetite, loss of sleep, diabetes, weak immune system, developmental full-blown anxiety and depression. And anxiety, you've got the negative coping methods like alcoholism, substance abuse, and then you got development of sleeping disorders like sleep apnea, and then you got suicidal thoughts, heart disease, hypertension, then unhealthy cholesterol levels, and then gastrointestinal issues like irritable bowel syndrome. So now we're going into my case study. So the client is a 25-year-old female who is currently a graduate student and lives a sedentary lifestyle. She has exercise-induced asthma and uses her inhaler as needed, but she smokes 2 packs a week, and she is 5'7" and only weighs 120 pounds. And then both her mother and her aunt were diagnosed with osteoporosis, and sadly her mother passed away after having a myocardial infarction at the age of 57. So the client is diagnosed with general anxiety disorder and was recently prescribed Tylenol for 6 months. And then before being placed upon the medication, the client complained of frequent chest pains, shortness of breath, and rapid heartbeat. And it was deemed a result of her anxiety. Her blood pressure levels, total cholesterol, HDLs, LDLs, and fats and lipids, all are normal levels, which is very good. And so with risk stratifying, they say that her age is not a risk. Her activity level is because she is sedentary. Family history is a yes because her mother passed away before the age of 65 with a myocardial infarction. The fact that she's a smoker is not good, so that makes it a risk. Her BMI is 18.8. We know that the normal level is 18.5 is considered underweight. So we need to talk to her about eating habits and developing a good dietary plan just to help increase her overall health. So we know that she's definitely not obese. She's not hypertensive. And she doesn't have any. She's not diabetic either. But she does have a pulmonary disease because she does have asthma. And even though it is only exercise-induced asthma, it needs to be treated as such a serious disease. So for the exercise test, we're going for the graded exercise max test with a physician present, of course. And we're doing the Bruce protocol treadmill test to determine the severity of her exercise-induced asthma. And because of this, and because of the fact that she was high risk. And so we're going for a symptom-limited maximum, because if she does feel any symptoms of her asthma and the bronchospasm that occurs with it, then we really do need to stop because we don't want to risk her health. And then we also want to do a muscular strength test, so the 1 rep max. And things to note, so we need to note that the client is on a beta blocker, which will affect the heart rate, and we won't get a true maximal reading. We also need to monitor the potential for her angina, which is heart pain. She'll be using an angina scale, which is rated between 1 and 4. Because she is on medication, we shouldn't suspect her to be feeling any pain because of it. We also need to caution asthma symptoms like wheezing, and make sure that she has her inhaler very close by before testing. So exercise prescription. So we want first the exercise is really good. We don't want to ever view it as a chore. We want her to see it as her way to get away from the life's daily stressors, because exercise is medicine for her. And so for the cardiovascular exercise, the frequency is 3 to 5 times a week. Goal, we're trying to hit 5 days a week, because it will really help with her signs and symptoms of her anxiety. Then intensity, whether or not it's moderate or vigorous, we're going 50 to 85% of her heart rate reserve. Duration, we're going 30 to 60 minutes, again, depending on how hard we work. And then the types, we're doing rhythmic activities like running, jogging, swimming, dancing, rowing, hiking. And we really want to see improvements in her overall cardiorespiratory health and improvements in her VO2 oxygen uptake. Then resistance training, we're going to look at the frequency, which is 2 to 3 times a week, and hopefully working up to 3 to 4 times a week, because with the development of osteoporosis very prevalent in her family, we really want her to make sure she strengthens her body, especially focusing on strengthening the legs and the lower back, which are common sites for osteoporosis. And so the intensity is 60 to 80% of the 1 rep max. Duration, 3 sets with 8 to 12 reps in between each. And then the types, we're going to be doing dynamic exercises, single joint exercises, and incorporating some circuit training. So we're going to be using a variety of free weights, machines, really to just get her back on track with her exercise. And then for flexibility and balance, we're going to do some yoga, because as we know, yoga will help with staying her mind, being calming. So we're going to do it 2 to 3 times a week, 30 to 60 minutes. So conclusion. So we all know exercise is medicine. And especially with the stress and anxiety disorders, exercise is one of the most beneficial things. It can really help with managing all the symptoms, as well as just improving the individual's outlook on life and how they feel about themselves. And then we need to know that stress and anxiety disorders are very serious health risks, and they should be treated as such. They're not a joking matter, and they should be considered as dangerous as everything else we've talked about. And as you see below all of my sources, I hope you enjoyed my presentation.